and your cough is not getting any better, you make sure that your doctor should examine you for cancer of the mouth. Is coughing, you have a chronic cough. Normally when you cough for more than 3 weeks, you start thinking about TB. But if you've been on TB drug and your cough is not getting any better, you make sure that your doctor should examine you for cancer of the mouth. Medical profession. And the topic tonight is what are the causes and the effects of self-treatment or self-medication and buying of over-the-counter drugs, OTCs. Because there are lots of people in the world, not only in Zambia or in Africa, who like to buy drugs from the chemist or the drugstore or from the supermarket, and they want to treat themselves. And now there are many reasons why people do so. And that's what we're going to discuss, and I'm going to explain to you what are the challenges when you buy a drug from over the counter. They are actually useful. It's not that every drug bought over the counter is a challenge, but then we are seeing, and in my experience, I'm seeing a number of people who had problems that they could have sorted out some years ago or some time ago, but because they believed they had self-diagnosed themselves and they thought they knew what the problem was, they have been buying drugs and taking them, thinking that because they have a bit of relief, or they have a bit of some belief, or because of some form of stigma, they believe that, well, I've taken medication and that's enough. They get a bit of relief and they think that's it, I'm feeling better. But actually, they may be causing problems in their lives, because you cannot just buy drugs off the counter. And sometimes when you find out that the source of the drug is a challenge, and you may get drugs given to you by people who are not qualified. And then you have these illicit drug stores all over the place, and people may sell drugs on the streets, they sell them in minibuses, they sell them in their homes, and you don't know what you're actually getting. So today, it's my pleasure to try and liaise with you, to teach you, educate you, and I would like to also have some response from you. So before we start, you have an opportunity to send your SMSs on 0978 437 437. I would love you to participate in the program today, because you also might have your reason. Why is it that people like to buy medicines over the counter or from every different kinds of sources without getting expert help and advice? Because there is a reason why doctors have been to school, and it's the duty of the doctors to prescribe a drug for you, and the chemist is supposed to dispense the drug. So you should not just go in and then get yourself a prescription over the counter. You just say, I'm having abdominal pains, or I'm having headache. You haven't been investigated. And there are people who are guilty. They've been having problems. Like I had someone just a few days ago who's been having abdominal pains for ages, and they have not actually investigated the person properly. And another one who's had headache, every time saying headache, 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 and taking painkillers and it feels better. And another one who actually has been complaining of backache, 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 backache. And I said, look, have you ever had an x-ray? And he said, no. I said, can you please, because of your age, can you do an x-ray instead of just taking painkillers and doing physio? Just to find that the bone has started being eaten up. And we traced it to cancer of the prostate, which had just started, which may have been there for some time. And you see, in such a case, if that person had continued taking painkillers, that bone would have been broken and he would have ended up with paralysis. And I've had this thing of taking antacids for digestion, indigestion, oh, it's just indigestion, oh, I have gas. That's a very important symptom you hear for people these days. What do I take? I have gas. But you have not been to see the doctor. And so what happens is that that gas might end up being an ulcer. It might end up being cancer of the stomach, which we have had in some people. And there are different complications. You have maybe you've got problems from your digestion, but you haven't investigated. And so you can end up with different complications. Now, I just want to alert you to say it is not that every over-the-counter drug is bad. And sometimes there are some of these drugs, like an example which I saw in the UK, the drug called Canesten, which is a drug for vaginal discharge in women. Because it is so common, because of the weather, people have to wear a lot of trousers, and wearing a lot of trousers can predispose you to having yeast infection, and a lot of people there may use bubble baths. They have different things they can use, and that is not right. And there is a reason why doctors went to university. So you need to have medical help. And to make it important today, I actually went around talking to some of my friends. There are some friends, even my staff at the clinic, some friends from the bank and different places, and even here at the studio. And I just wanted to know, why do you people buy medication over the counter instead of going to the doctor? So let's look at some of the examples that were given. But I must emphasize as well that, as I said earlier about some of the drugs, some of them, which as long as they're not potent, they're easy to get. You may have a headache, you just get 2 tablets of Panadol. You may have flu. You may or may not need to take medication, because sometimes the flu does not necessarily need medication as such, unless it becomes very uncomfortable, because it takes 5 to 7 days for it to heal. So there are certain drugs where you don't really need to see the doctor. You know that this is a flu, unless you start having temperature or complications. Then you need to seek additional help. And if you've been coughing for more than 5-7 days and it's not getting any better, of course you need to go and see a doctor. And in Africa, in Europe, in the other countries, you have flu, it's just flu. But in Africa, you have flu, you can bet your $100 that there is bound to be some other complication which is related to that particular infection. So it's not all bad. There are some drugs that you, like Calpol for children. You need to get at least, whilst waiting for the doctor, you give 1 dose of Calpol, and then you don't keep on giving Calpol for days when the child's temperature is gone on for a long time. You go and see the doctor the next day. If it's at night, you give Calpol to bring the temperature down, then take the child to the doctor the next day in case you don't have transport and there are complications. So there are a few things that you can have as a first aid in your drug cabinet if you have one. Like you've got a wound, you have to have plasters, you have to have spirit, Savlon, swabs. Some of those things are just basic things that you need to have on standby in case of emergency. But to be having strong drugs, which is either you yourself, you went to the doctors and you were given the first time, and the next time you have the problem, you go to the chemist and you buy. This is what I was given last time, which we are guilty of. And instead of going back for the doctor to review you to see whether that medication has worked, or maybe you need to change or increase the dose, you go and just by keeping wondering why the medicine is not working when you should have had further investigations. So these are some of the examples which I'm going to give you. These are real examples that people have given as to why they buy drugs over the counter. So as we are continuing the program, please, you can SMS or send your SMS, your message, if you have an example, if you have a testimony, or if you have a time when you may have bought drugs over the counter and then you have found out that you had some other problem afterwards and you now regret it. If you want others to share in your testimony, please do so on the telephone number on the screen, 0978 437 437. 0978 437 437. Now let's look at some of the reasons that people gave, and some of them which I know of reasons why people buy drugs over the counter. Well, some of the ones that are common is that people think that if they have to go to the doctors, it is going to take time for them, whereas it's easier. As one of the young men told me, it's much quicker, doctor, if we have to go to the hospital, we have to make an appointment, or we go in and you have to wait in the queue to be seen. Whereas if I think I have abdominal pains, I'll tell the doctor, last time I took this medicine, give it to me, and then you think that's fine. But then the other thing is, the other danger is that you might be masking the symptoms. I mean, that could be a warning sign of a problem which you could have had treated the first time, but because you've been suppressing the symptom, you may not be able to diagnose this on time. Another example that is very popular, or that has been very popular in my little research, is the fact that some people say, I don't have the money to pay for the consultation, or I don't have the transport to go to the hospital or the clinic, and maybe the drugstore is next to me, so I just walk in and I tell them, can I have this drug? And you're giving. And then there are others who've told me that, well, you see, if I have to go to the doctor, at least I may have a disease I don't want people to know. And this young lady said, confidentiality, that if at least the chemist will just give me the medication, he may not have to give me, I may not have to know the details of the problem that I'm having. And they might stigmatize me if I go to the hospital and the doctor has to make a diagnosis, then people will know what the problem is. I mean, I think this is very wrong, because you're hiding your symptoms. You're making things worse. So at the time when you are going to be diagnosed, it is actually going to be a big problem for you. And there are others who give the example that I know what the problem is, so why should I go to the doctor to be told what it is, when they have told you that you have, let's say, pneumonia at the beginning, and then yes, you had pneumonia, but then that pneumonia was secondary to a tuberculosis infection. So you treat the pneumonia, but there is underlying TB. But you keep taking medication and not going back to have your X-ray checked. You're still coughing, and you still think it's the same pneumonia. So I think you understand what I'm trying to say. So it's very important for you to go back to the doctor and let them examine you and see whether you need to repeat the prescription. You cannot keep taking the medication over and over again. And then there are others who are saying that besides the time and besides the fact they don't want to see the doctor, others are saying, well, I know that if I go and the doctor diagnoses me with something which is similar to what my mom or dad have, it's better I don't know. And another one was saying that it is possible I might lose my job if I go and see a doctor, and then maybe I'm taking time off because I'm sick, or I'm taking time off because I have to go for review, and I may not be able to do my work, and I'm the breadwinner, and I might lose my job because of the time that I'm wasting to be away. So what I do, I just take the medication, hoping that it will keep me going until when I have time, and if I think there is a good reason, I'll go. Another example someone was saying is the behavior of the staff. When you go to the clinics, the way you are treated and the way that they behave to you. So you don't feel like going back there. And maybe that's the only clinic which is around your house where you are staying. And so the best thing to do is to try and treat yourself until such time. And you may need to go to the consultant to be referred to a specialist, but you don't know where to go. Others say, I don't know where to go, and it will take time to try to find someone, so it is better I just buy over the counter. But then I said to them, don't you think that you need to have expert advice? You need to go back to the clinic and then explain the problems you're going through. The government has put on so many clinics all around Zambia. And now they've even got class 1, class 2 hospitals now. So it is for you to access that care, which in most cases is free. So why would you want to go and start buying a drug which is not going to help you? And we've had people with cancers, like cancer of the stomach, and a lot of them are complaining of indigestion. I had someone who had cancer of the liver, because the liver was pressing on the stomach and she was not eating and having indigestion, so she kept taking antacids. And that is a very big scandal among us Africans and among us people, taking medicine for indigestion and for gases and heartburn. And you think 1 teaspoon, you should not think that by drinking 1 cup or 1 teaspoon or 1 tablespoon or even double the dose will get you better, because this is one of the complications that people have, and said, look, there's no need. So I drink that and I just buy medicine over the counter to continue to live with it. But you need to be very careful to look after yourself. And yes, culturally there are drugs that we know in our society that can work, but we need to be careful with what we do with our lives. And it's unfortunate because those drugs are being sold to us at a higher price. But because people are impatient and people do not want to know, they feel they don't have time, they think that there is no time, no need to see the doctor. Others are trying to hide, they don't want many people to know what the problem is. I have an example of a man who was brought to me several years ago. He collapsed in his office, and when he was coming, the friends came with him with his medication from his cupboard, and among them was ARVs. And when the wife came and I was trying to explain what happened to the husband, she was shocked, because this man was drinking ARVs in the office. The wife never knew that he was taking medication. So you find people don't want anybody to know, so they'll go over the counter and say, just give me this medication. And because the chemists, they are guilty, because they want to make a little bit of money, they will listen to your symptoms. I've got headache, my pain is like this and like that, and they give you a drug, but they haven't examined you. You see, they haven't examined you, they haven't seen if there's any lump or there's a mass or anything like this. They've given you something they think would work. And whereby if you had seen a doctor, the doctor was going to examine you and do some tests and see what is the cause and give you treatment accordingly. But because you think that it's cheaper, so you do it at your own will. And I know, as chairperson of the faculty of general practitioners, we tried to fight that the people should not be given certain drugs over the counter without a prescription. And even as a member of the technical working group for malaria, we were saying that people should not buy Coartem unless you have a prescription, but it's being sold everywhere. So it's a big challenge. It's a big challenge in our society. But people need to know the dangers, because everybody thinks every fever is malaria. So you go to the chemist, you buy Coartem, you start taking it, and that's one of the reasons why chloroquine became resistant, and ampicillin became resistant, because these drugs end up being abused, and people even get used to these drugs, so they get addicted. So, and that becomes a problem. And then you find that there are no drugs available for treating the other people. So there are quite a number of reasons why people would like to buy, because of the stigma, the confidentiality. They think that the staff where they're going wasting their time. They may not want to lose, thinking that if they are found, they may lose their job. So there are quite a number of reasons why people like to buy medicine over the counter. So if you want to continue, there are some questions here, but they've got nothing to do with the program. The program tonight is the causes and the effects of buying over-the-counter drugs. Causes and the effects. What are the reasons why people buy drugs from over-the-counter, and what are the effects? So I would like to hear from you in relation to that. Some of these questions, if I have time afterwards, I may answer them. But please, what are the causes? Why do people buy drugs over the counter? Why do they go to the chemist and buy drugs instead of seeing doctors? And what are the effects? Because they may not know what is the danger of what they are doing. So let me go on the effects now. And I would like to hear from you. You may have a reason why you don't want to see the doctor, which I have not mentioned because I said there's a long list. But let's hear it so that I can see how best we can interact together. So send your SMSs. Please do not call on 0978 437 437. Now, what are the effects that these drugs can do? First of all, you have asked for the medication, or you may just go yourself and take the medication from the counter. Maybe it's something you've been using, and then you go ahead and take it, and you may underdose yourself, or you may overdose yourself. That's one. Secondly, you may have what I call drug interaction. You may be on medication, and you need to know that drug you are taking. That's why you must see a doctor. How is it going to affect the other drugs that you are taking? Because there are certain drugs that are detoxified by the liver, and there are certain drugs that are detoxified by the kidney, and others pass through the stool. Now, if you have a problem, for instance, a liver problem, there are certain medications that you should not take. If you have a kidney problem, there are certain drugs that you should not take. And sometimes even the drugs themselves will interact. I'm not going to give the names of the drugs because I don't want people going to over the counter to buy medicines. But if you don't know and you're already taking something and then you take medication, even if you are not taking any medication, there are people who interact with certain drugs. These are the common ones I'll mention, like aspirin. It's not everybody who can take aspirin. Some people are allergic. Some people may have a bleed. If they have an ulcer or some inflammation in the stomach, you can bleed from taking aspirin. Things like non-steroidal anti-inflammatory drugs, like Brufen, like diclofenac. Now, there are a number of drugs. You have to be very careful if you have an ulcer or if you have some problem in the stomach. Some of these drugs, either you don't take them or you take them with food whilst you are eating so that it cushions the effect, because the acid in the stomach is battery acid. So in other words, if you keep on going to the chemist and then the next thing you hear them coming to say, oh, I'm having a lot of indigestion, I've been taking diclofenac but it's not getting better. And I just said, no wonder it's not getting better. You cannot be having indigestion and you're taking diclofenac. So those things are very important, and one of the dangers of buying medication over the counter, because of the side effect of that drug on you, and the fact that what other condition have you got, what other drug that you are taking that could interact with that drug that you bought from the chemist. And so you need to be sure of what you are taking, to ask your doctor, this drug I'm taking, is it okay if I'm taking this drug or that drug? But if you just go over the counter and say, okay, my friend is using this drug, so let me take it as well, you can end up with complications. And people also abuse these drugs. So one of the side effects is abuse of the medication, that they just keep taking, and then eventually a number of these drugs, people get addicted to them. I think simple things like Valium, you can get addicted. Antidepressants, anti-anxiety drugs, some people get addicted. Some painkillers, and you come to a point where this person is so used to taking that painkiller that no other medication works. If he or she doesn't get that medicine, like things like pethidine, there are quite a number of drugs. As I said, I don't want to call a lot of them because I want you to go and see your doctor. If I start telling you now, then it means there'll be no need for you to go and get expert advice. So some of these drugs, like pethidine, I'll mention pethidine, these drugs can become the narcotic drugs. You can become addicted. Codeine. So there are so many of these things, and that's why you hear stories of minibus drivers are now abusing Benylin, and even in Zimbabwe, I hear there's a drug that is being taken by practically almost the young ones. You can take a drug which, if you're okay, but when you take it, it affects your liver. When you take it, it's either a reaction or it causes damage to your liver, especially if you take excess dose. Even African medicine, when I was in UTH, we used to have children come in with acute kidney failure because the parents had given them African medicine. Even in labor ward, you find women who take African medicine because they want to go into labor and they want the labor to be smooth. So some of these things is very important that we are developing now in Africa. So we need to be aware, we need to be cautious. We cannot be doing the wrong things that we have been doing in the past. We need to wake up and look after ourselves, keep our bodies healthy. And then you find that with the use of these medications, with the addiction, the abuse, and the fact that you can have a side effect which can be detrimental to your health, which will give you further complications, and then you end up having to go into hospital. And besides, some of these drugs you need to have counseling. Now nobody has counseled you, but you know about it, and you just go over the counter and say, "Give me this drug." And the ones I found, not recently, I was at a chemist, and this father was buying medicine for the child who was coughing from the chemist, and I said, "This is child abuse." And then, interestingly enough, he knows my voice. I said, "Are you the lady who's on?" I said, "Yes." "But why are you buying medicine for the child from the chemist? Why didn't you take the child to go and see a doctor?" People say because they are busy, they don't have time. Well, if you don't have time, then something else happens, then that can be a big problem for you. And then, of course, people, when they have side effects, they may not even be aware that the side effect that they are having is because of the drugs that they are taking. And then somebody ends up with a mental problem or a kidney problem, or even dies from a shock because of the drug that they were taking. So these are some of the things that you and I need to be aware of, and which we need to take special care to look after. Sorry, there's some messages in Nyanja, Bemba, but I'm not very good at Bemba. Okay, so send your SMSs to 0978 437 437, 0978 437 437. So the complications are so numerous. And meanwhile, you are thinking that by going to the chemist, yes, you may find that you don't have a queue, you don't have to wait for a long time. But then, what happens if you end up buying a drug that you didn't need? What happens? Because you actually suppress the symptoms. That is the other side effect. You suppress the symptoms. So instead of being diagnosed there and then, you suppress the symptoms. I know of a case, I'll give an example, somebody who had breast cancer, and it had gone to the spine, and she was complaining of backache, and then by the grace of God, I came and I said, "Can we just let's get the history all over again. Why is this back so painful? Have you ever had an X-ray?" And she said, "No." "Can you go for an X-ray?" And we found the bone was being eaten. And then we found, I said, "There must be something eating this bone. This must be cancer." And that's when we traced that it was actually from the breast. Because it's not every time you have breast cancer that you have pain. Even cancer of the prostate, people have been having backache, even being paralyzed, and they were taking painkillers, and you're going to see the doctor, you're not getting any better, you are just taking painkillers without doing an X-ray, just to find out that the cancer from the prostate has gone into the spine, which is one of the areas where cancer of the prostate goes to. And so the person comes with a complication, whereas if that cancer was diagnosed early, people are now living longer, because early detection saves lives. And so if you keep having a persistent pain, persistent chest pain, persistent indigestion, persistent backache, persistent headache, for instance, some of those problems should tell you that there is something else. Don't keep on taking painkillers. You need to find out what is this all about. And besides, the painkillers, there are different types of painkillers. There are some which are more of an anti-inflammatory reason. There are some which are for things like bowels, like if you have something in the abdomen, they work better for the abdomen. There are some which work better for the bones. So you have different types of painkillers, and if you keep taking the same painkiller, and one of the biggest culprits in our nation is people taking diclofenac and brufen for stomach problem. That is very common, I'm afraid, and that's a very big risk, because you can end up with perforation, you can end up with ulcers, you can end up with bleeding, where you can go into shock, which I've seen, and you can even end up with ulcers. And I've seen a patient where the stomach perforated to the back, and it was an emergency. Another one who was just having anemia, no other symptom, and even imagine when we examined the stool, we found that there was blood in it. When we did an endoscopy, we found that there was a big ulcer which was bleeding, and this person never had any other symptom. So you see, you might be thinking that that is not important, and you end up thinking, yes, no, she was bewitched or he was bewitched, because nothing was found. And in fact, that gentleman, if we had not done an endoscopy, the way he was lying in the bed, there was nothing else to show that there was bleeding which was going inside. Another one went out drinking, came back at night, and had a headache, and he took 2 aspirin, and he started bleeding. They had to cut part of his stomach out. So, and that was very serious. He ended up in ICU. So there are really serious complications in us not taking our lives seriously, in buying medicines over the counter. I know that when people, and when they're not, sorry, there are quite a number of questions here on other conditions, but I am more concerned about over-the-counter medication. I think if you want to participate, please send SMS or SMS on 0978437437. Let's talk about this problem, which is a very big problem in our society. I know people might be saying, you can say as much as you want because you have money to pay for the drugs. For me, I think it's cheaper for me to buy from the chemist or the drugstore. And some of these drugstores, as I mentioned, you need to find out, are those people actually qualified? Because one of the complications is that you can buy expired drugs, and you can be given the wrong medication, which may sound like something else. And you need to know whether the person who's giving you the drug needs, if it's a proper chemist, will tell you that this is the kind of side effects that you would expect. Please do this or do that. Like Flagyl, it's a drug that is abused in our environment. Because a lot of people, when they have diarrhea, they will say, oh, I took Flagyl, I'm feeling better. They have a vaginal discharge, oh, I took Flagyl, I'm feeling better. And you know, they have so many reasons why they take Flagyl. But you know that to take Flagyl, fine, it's okay if it is done for the correct reason. But Flagyl with alcohol causes a very severe complication in that person. So you are busy taking the medication without realizing what are the side effects, and you need to be very careful on that. And for you who are just taking drugs without knowing that the effect of alcohol on the drug, because there are people who say, oh, I am going out for a weekend, can I take this? Now when you tell them too many do's and don'ts, they think you are wasting their time. Then let me go and buy from the chemist. At least the chemist will tell me to take this, without knowing what is your history, what you've been doing, how your lifestyle has been. So these are some of the things that making sure that you get information from the right personnel, from the right source. You don't get expired medication, which can cause problems in you in the long run. And we know of stories that are being told of some of these stories where people are given drugs where they take them, and then you find out that the drug comes out in the feces without being digested, and investigations had been done. So these are some of the stories that are true, that are actually going on. So you don't just buy from any drugstore. I know that we do have people who can't afford but that is no excuse why scrupulous people should sell them drugs that are not effective, and drugs without labels or something that is written on them. We don't want to start making money at the expense of killing our people. The people of Zambia must live and they must enjoy their life, because the Bible says, I pray that, brethren, you will prosper and be in good health, so that your soul prosper, in 3 John 2. We are all supposed to prosper and be in good health so that our soul should prosper. So disease, sickness was overcome by Jesus on the cross. So his people are not supposed to be sick because of doing the wrong thing and taking the wrong medication. And we should not abuse one another because of the fact that we are not able to advise people on the wrong thing because we want to make money. I'm sorry, I can't answer calls. Please send an SMS on 0978 437 437. Send an SMS, please. Thank you very much. Every question is very important. Good afternoon, Pastor Makondo. Doctor, do you have your own clinic? In most cases, people have been sent back by clinicians to buy medics, and now they are used to that. Please help. I do have my own clinic, and I've had it, and one of the reasons why I started my clinic after having worked at UTH onto a senior position was because I was not very happy with what was happening in the society. And I thought, well, I'm not good, but at least I can do what I can to help the people around. And yes, sometimes a patient needs a drug, and that drug is not available, and that patient could be given a prescription to buy from the chemist. Now, if you go to buy from the chemist, if, for instance, I give an example, if I say go and buy an antibiotic, and then you go to the chemist and they don't have that drug, you have to go back to the doctor. Or the other thing that is supposed to be done is that chemist should call the doctor, because on the prescription the doctor's name and telephone number is there, and say, okay, you've got Miss Piri here, you've given a prescription for this, that, and the other, and this is the situation. I don't have the drug, but I have an alternative. Can I exchange it? And then you communicate. But it's not for you, the chemist, which when I did a program on Radio Phoenix once, somebody was complaining that each time the doctor prescribed something, the chemist would change the medicine. And I know that the provincial medical officer wanted to know from that person who was on the line where this doctor was. How can the doctor go and how can the chemist go and change a drug that has been prescribed by a doctor not more than once? So it's a habit, thinking that then it means that you think that the doctor doesn't know what he or she is doing. The best thing is to engage that doctor and find out from the doctor that this is what you have got. Can I have this something else? Can that work? So yes, they can give. They're sent back by the clinicians to buy medicine. Although it is advisable for us to at least get a few of those drugs available in our clinics. And now you are saying that they have been, Pastor Makondo is saying that people have been used to that. So now because they are used to that, they just go to the chemist. Well, it's not exactly a right thing to do. Because maybe I gave you a drug, an antibiotic, which is not working, and you keep on going to collect that medication. You should go back. Maybe I might need to review you and need to change the medication that you are taking. People should not just get used to repeat prescriptions without getting advice from the doctor. Okay. There are some questions here which are not for. Okay. Right. There's someone from Mansa who says is enjoying the program. Thank you very much. I hope it has been of use to you. I'm sorry, I'm just trying to see the ones that are necessary for the program. Right. So let's concentrate because I think it's very important that you understand the importance of whether you should buy over the counter or not. So people have had. What if you have? Sometimes you have a reaction, an allergic reaction. when you buy from over the counter. Besides the effects, there is a drug reaction, whereby the drug will interact and will cause you a problem. And then you can have an allergy where you can end up having a rash all over your body and you are scratching. And for instance,